Welcome to Covered in Pet Hair, a boozy show for pet lovers on Pet Life Radio. I'm your host, Isabel Alvarez-Arata, and today I have the pleasure of having a drink and a chat with a relief veterinarian, freelancer contributor, and all the things veterinarian who's also a fear-free veterinarian, and she's going to teach us all about cat versus vet. Welcome back to Covered in Pet Hair. I'm your host, Isabel Alvarez-Arata, and today I have the pleasure of having a drink and a chat with a pet parent, a veterinarian, a freelancer, and contributor. She's a relief vet, a volunteer, an adventure seeker, foodie, and coffee lover. She's a world traveler, a breadaholic that visits bakeries when she travels, which is so cool. She's a bird watcher in her backyard. She's originally from Des Moines and currently lives in Austin, Texas. She's partner to Brian, cat mom to Puff, a 14-and-a-half-year-old domestic short hair mix, and dog mom to Dory, an 11-year-old poodle mix. She's a fan of pet puzzles and enrichment. Her cat is actually away doing a pet puzzle right now. Her name is Dr. Julie Leal. Welcome. It's so good to have you on the show, Dr. Julie. Is it okay if I call you
so
Dr.
much.
Julie?
Yeah, or
Okay.
You can call me Julie, whatever works.
I like Dr.
It's exciting
Julie.
and the most important thing that you mentioned was my bread obsession.
Oh my gosh, I love that so much. I think we all have like a thing that we have to do when we travel, and I don't think people kind of recognize that is what they like, that brings them joy. So I loved to learn that little tidbit about you.
It's hard to find good bread, seriously. Like
Have
I'm
you
going to
been-
Minneapolis in a couple of months, and last time I was there, like I used to live there, but I found this really great German bread bakery last time I was there. I definitely packed quite a few loaves into my suitcase, and I can't wait to go back there and bring my little, as I call them, my food treasures back.
Oh my
me.
gosh, that's so fun. Have you been to Paris yet?
Yes, I went there several years ago. Yeah, I definitely did some bread eating there. But
Yes.
it's weird. It's hard to find really good bread bakeries. Like there's, like French bread bakeries and things like that, but I'm more like a really crusty, like multi-grain loaf. I know. And I have a chest freezer too. So this is where all my bread treasures, go into, because bread freezes really well. So
Yes.
just,
Oh my gosh, I need to do
for you.
I need
So
to
we're gonna
do
talk about
more
bread
of
this
this
whole time, right?
No, I do. I'm a breadaholic too. Like, I mean, my family's
Yes.
from Spain. We grew up eating
Okay.
bread at every meal. Like, I love bread. Obviously, I'm like Oprah. I love bread, but I shouldn't have too much of it because,
Yes.
packs on the calories. But
Yeah.
if it's like a really high quality bread, I feel like it's better for us. And it's not like this, it's an indulgence that's like something that I feel like is okay, rather than like some like, store-bought plastic wrapped bread.
Yeah, definitely. If it's like spongy texture, not as good as like a good crusty. Yeah.
Yes. And I love a multi-grain bread. Like in Spain, I always order, like, I don't like the regular baguette. I always get the multi-grain baguette.
Yeah.
So yeah.
Yeah.
So
it's
love
so much
it.
better.
Now I'm going to have to go get some bread and butter
Yeah.
after this. Everybody's going to need to get some bread and butter. Well, before I get into the interview and getting to know you, Dr. Julie, I'm so excited to have you on the show. I want to introduce our drinking game today. So anybody participating in our drinking game at home, anytime you hear this word, make sure you take a drink of whatever you're enjoying, but please be over 21 in the US to partake. Never drink and drive, and always drink responsibly. So what are you having today, Dr. Julie?
Well, I am kind of lazy. So when I saw that this was part of the show, I went and Googled mocktail, and I thought, I really don't want to make an extra trip to the grocery store. So let me think about what ingredients I have. I don't like stuff that's too sweet. So I thought you might enjoy this glass as well. So I have this watermelon kind of like spritz cooler thing that literally just has 2 ingredients, because once again, I'm very lazy when it comes to putting stuff like this together. So it's just, I had some frozen watermelon, so I defrosted that overnight, and then I blended that with just some diet, like generic Sprite stuff. This is from I did not invent this recipe. It's from Food Network online, Ina Garden, but it's in a commemorative Princess Bride glass.
Oh, how
so
cute!
I don't know if you can see that.
I
It's
love
yeah,
it.
definitely one of my classic films from childhood. So
Oh my gosh, that's one of my husband's favorite movies. Yeah,
yeah, and
he
the
might
book
kill me
is
for
really,
saying
really
that.
good too. Yeah, highly recommend the
Yes,
book. Yeah.
absolutely. Well, I'm actually very big on semi-homemade too. Like I very rarely go out and buy like a new spirit or something for a cocktail because I don't want to just use it one time and never use it again. So I
Yeah.
actually made a pineapple martini. This is vodka, this is
Oh,
pineapple juice, a little bit of muddled mint, and cheers. Thank you for being on the
it looks
show.
good. Yeah, cheers.
It's very good. Pineapple's one of my favorite
Hmm.
things. So I pretty much use pineapple in everything. So I want to get to know you, Dr. Julie. I know you mentioned briefly, and we met at the Texas Pet Sitters Conference. You were one of our wonderful speakers. You went to kind of promote Fear Free for pet sitters, which is to me so important, such an amazing course that pet sitters can take. But you are also a very well-rounded veterinarian who does a lot of things for different organizations. So I wanted to get to know you and how you ended up in the veterinary field to begin with.
Well, it's sort of a little bit of a longer story that I'll try to condense for you. So a lot of people in my vet school class went straight, like they always knew they wanted to be veterinarians from childhood. They went through college knowing they were going to be vets, then went straight from college to vet school. And that wasn't me. I thought when I was a kid, I thought, I really wanted to be a wildlife biologist because that seemed really cool. And then I wanted to be a writer. I actually went to school for writing and, in college. And so I didn't actually, become a vet until later. So I ended up like working at Half Price Books and then working at a music school, just kind of, trying to find my way. And I think what really drew me to, vet school is actually interest in behavior because I was trying to get, interests. I was trying to get experience before vet school. And I started volunteering at this place in the Twin Cities where I lived called I think it was called the Animal Humane Society, but it was in Golden Valley, which is a little suburb of the Twin Cities. And I volunteered for this thing called the Behavior Helpline, which is where pet parents would call in with their behavior questions. And to me, I was kind of, it was a really great program. It was actually supervised by a veterinary behaviorist who's a vet who's board certified in behavior. And I've actually found there aren't that many veterinary behaviorists worldwide. I think there's fewer than, there's probably like 90, maybe something
Yep.
like that. And so really cool that somebody would, be supervising this shelter program. And so, but yeah, just so we had like a little manual with like, questions like, oh, what do you do if someone calls about house soiling or something? And so for me, I was just early 20s. I didn't know anything about really anything veterinary. And pet parents would call and ask about their behavior concerns. And I think it was really cool to have this resources for pet parents. But at the same time, I also thought, God, why aren't they asking their vet these questions? Like, I'm just I'm a
Mm.
volunteer. I'm not a veterinary professional. There's plenty of vets in the Twin Cities. Like, why are they not reaching out to their vet? Like, what is it about, their vet experience that doesn't make them feel like either their concerns are valid or that they maybe are being addressed or maybe they're being brushed aside for medical issues. And granted, this was a while ago, so we didn't know as much about behavior like we do
Right.
now. But yeah, so that kind of got me into thinking, well, I really want to, go into veterinary medicine, work with small animals, and then really try to kind of think about this behavior aspect. So that's kind of how I kind of got to vet school, is like a little bit later. And I'm really glad that I ended up taking time between college and vet school because I don't know. I think vet school is definitely not easy, and having
No.
that mental fortitude to get
Yeah.
through it. And my closest friend in vet school was named Seth, and we're still friends. But we would go bird watching. We would talk about music and movies and just completely non-vet related stuff, which I absolutely love because it's like you don't want to be 24/7, just totally entrenched talking about vet med all day
Yeah.
long.
Yes,
And
especially because
yeah.
you all study so much. Like you don't just most people. I interviewed a vet behaviorist, Dr. Chris Pockle, and we
Okay.
talked about what it takes to become a veterinary behaviorist, but we also
Yes.
discussed what vets study in school, and you study all the species, all the things. And I guess I can imagine that's so overwhelming. And just like, how do you not even like mess up like a cow versus a pig versus a horse versus a cat? Like, I mean, it must be so much information overload.
It really was. And I do think, I hope that vet schools continue to evolve, because to me, like back then, I don't think there's really that much critical thinking. It's just more like rote memorization and then regurgitating. And it's like, so, and that's not the way it is when you practice as a vet. You're actually using a lot of critical thinking.
Right.
So I hope that continues to evolve, because I do think it's, you know, if you could memorize, you could do well in vet school. And that, I don't know, there's so much more to being a vet than just doing that. Yes. And yeah, I would just say that I haven't touched a large animal since I graduated from vet school, even though legally I'm allowed to practice on them, which is also kind of terrifying. So.
Well, actually, on that note of, I guess, asking questions and getting to know you, I want to invite you to play a game I call Booze Ball. And I'm basically just going to throw this ball in the air. This is like an icebreaker ball. And I'm just going to learn just a little bit about you that's not related to vet med. Are you ready to play?
I am.
All right, here we go. Wherever my finger lands, that's what we're doing. What did you think you would be when you grew up? Well, let's say when you were like a child, like 5, 7.
I think I wanted to be a writer, probably initially a long time ago. Like I used to write stories, and actually would write these adventure/horror stories when I was in high school, which, so it's kind of funny that now I actually do some writing that's, you know, completely unrelated to that. I think I was always interested in kind of artsy, kind of creative type things.
Well, that's really cool. And I think you should revisit those books that you were writing, those stories you were writing. All right. Yeah. 2 more. Let's see.
Okay.
Tell me about a proud childhood moment.
Proud childhood moment. I had to think back. Okay. This goes back to 5th grade. So I am not an athletic person. I don't like exercising, but for some reason, so I was a tomboy growing up, and for some reason, like I would always be climbing trees and, you know, running around outside. And in 5th grade, I remember like it was during recess, and I ended up running a race against one of my classmates, who is this boy named Brian Francis. And he ended up winning. Like he basically edged me out by like 10ths of a second. But I don't know, like I felt really, really proud, because back then, this was like before a lot of people hit their growth spurts and stuff. And I don't know, like it was just something that just happened spur of the moment that I felt like
I did it.
I still remember. Yes, I did it almost.
Yeah. Yeah. Well, you know, it's funny. That actually reminds me, I wasn't a child, but I ran the Army 10 miler a few years ago when I was kind of running, but I wasn't like a distance runner at all. And I remember being so proud of myself, because I wasn't really athletic growing up. My parents definitely did not encourage athleticism at all. So it was something I never thought I would do. And I agree, like once you actually do it, and of course I wasn't like amazing at it, but I completed it and I was super proud. So I totally understand.
Exactly.
Take that, Brian Francis.
I'm sure he's listening right now. He's probably gonna be contacting me.
All right, last one. Yeah. Something you hated as a child.
Something I hated. Okay. Well, when I was growing up, I never liked mushrooms, and even though I love them now, but so when my mom would make something with mushrooms, so we had a little Shih Tzu growing up named Caterpillar. And we would throw the food that we didn't want under the table for Caterpillar to eat. And so luckily these mushrooms were not toxic. Although I think in retrospect, I'm like, did we do that with onions too? And could we have given it?
Probably. I mean, let's be honest, you know, probably.
He was fine. He was fine. Yeah. But yeah, so I used to hate mushrooms, but then I grew to love them. And Caterpillar helped us dispose of many unwanted food items.
I don't know how I did it growing up without it. I didn't have an indoor dog. My mom wouldn't allow it. That's a very Latin thing that's changing. But we had to actually eat our food. My kids now, they don't have to eat anything. They just throw it out. But the only thing I will say is that the only dog that we have left is a very picky eater, and she's not eating their broccoli. Like she's just not doing it.
Okay.
You know, they're not hiding it very well with Kira. Well,
Yeah.
I actually thank you so much for playing that game. I love to get to know
Yeah, it was
people a little
fun.
bit differently than,
Yeah.
what do you do and how did you get here? So I do want to know though what you do as a relief vet, because I actually have never heard that term before. So if you wouldn't mind, I'd love for you to like tell me what it means and how you actually do that work.
Yeah, I've heard it described in different ways. So some people say it's like a substitute vet.
Got it.
So vets need time off. We know that there's not enough veterinarians and vet staff to see the pets that are out there, especially in the US. It's a major problem. So
Yes.
people are being scheduled out for, weeks in advance, ER waits. I mean, I think in some cases can be hours before you
Yes.
can be seen. And so relief vets really help support the industry. And it's not just relief vets, but relief technicians too, where we kind of go in, allow for that time off, support clinics that are, overscheduled, and kind of help with seeing different pet parents too.
Awesome. And you do that in Austin, or do you travel?
Well, that is sort of the dream. I'm actually licensed in both Texas and California because my
Cool.
sister lives in California, but I have yet to practice in California. I'm kind of wanting to work out the logistics of that. But yeah, they're actually just recently met a vet a few months ago who is a full-time traveling relief vet. So she doesn't even have a house. She lives in her RV. She travels with her 2 dogs, like just driving from like coast to coast. And, there's some like logistical issues, with that. But I mean, for many people, like she's living the dream. Like she doesn't even have a home. So,
right. Yeah, that's amazing. I mean, I don't know that it's, she might not want to do it long term, but as long as she's comfortable and the dogs are comfortable and she's not going to places like New York City with an RV, it sounds like an awesome
she goes to Long Island. She practices in Long Island.
Wow. So long as I guess she has a place to park the RV, she is welcome.
Yeah, exactly. I'm like, I would be scared to drive in New York, like that's especially cool. With an RV. Yeah, an RV.
That is really cool. No, you're never going to see me behind the wheel of an RV, like ever.
No,
especially not in like a place as condensed as New York. Yeah. Well, you also are a freelancer and contributor to various organizations. You volunteer. Tell us a little bit about the organizations you work with.
Probably the biggest one is Fear Free. So I joined Fear Free, or I started contributing to Fear Free when I was still on staff as an associate vet. And I think, I was always kind of obviously interested in behavior. Prior to becoming Fear Free certified, I kind of helped our clinic where I was working at the time become certified as a cat-friendly practice. So with that, I really started to kind of gain some knowledge about just the importance of the emotional health of pets, especially, cats and dogs. So I kind of knew I wanted to do some other things besides just clinical work. And I thought, you know what, there's a couple of Fear Free experts kind of in my area. I think I'm just going to reach out to them and see if they want to have like a business lunch type thing where we kind of talk about, is there some way that I could try contributing to Fear Free? And actually one of them is a veterinary behaviorist, and then he is married to a veterinary technician who is a specialist in behavior too.
Cool.
So they were really, really generous with their time, and they connected me with a content manager at Fear Free. So I started just contributing to the pet parent website, which is Fear Free Happy Homes, and then also doing some contributions to their vet site or vet professional site, which is Fear Free Pets. That was starting 2019. And then, from there, I don't know, I think from freelancing, I just start to think about, oh, this would be fun to do this, or I might try doing this. And I don't know, for me, I mentor a couple people, but I always just tell them like the worst they can say is no, or just ignore your email. Cause it's just, I feel like you can just very easily ignore somebody who's reaching out to you, and it really doesn't hurt to try. So, with the AFP, I ended up applying to become an intern for their board of directors, which I was last year. And then I started contributing to their cat-friendly practice committee, which is how it's a committee with a cat-friendly practice where they try to elevate the standard of care for cats, both with the environment, how cats are handled. It's an amazing program. And I think feel like I'm always just moving and trying to do things that make me feel kind of uncomfortable so I can keep learning, because I just feel like I don't want to be stagnant, and I really I love like new challenges and, like you mentioned, the pet sitters thing. And, I had never created a presentation for pet sitters before. So I was like reading about, what is it like to get fear-free certified as a pet sitter and what's their perspective? Because, obviously I've had pets, for years, and I really, really, it's super important for me to have a pet sitter who thinks about my pets, stress levels, anxiety levels. Both my pets have anxiety, and I just love to kind of think about all these different things that I can try.
Absolutely. And what AFP stands for?
It's the AAFP. So it's the American Association of Feline Practitioners. So they're the main group that kind of helps, figure out, well, they really kind of have high quality standards for different types of care. They issue new guidelines. They have continuing education. I think it's just, they really, really try to promote feline welfare because, as we might talk about later, I feel like in the vet world, especially, cats just don't get as much care a lot of times as dogs do, both from pet parents as well as, vet professionals who, I don't know, sometimes some of them just don't feel comfortable with handling cats.
Yeah. And groomers either, right? Groomers, there's it's so hard to find a groomer for cats because, again, they have a fear of handling them. And sure, cats make it hard for groomers, for sure.
Yes.
But they also need grooming sometimes. So I want to take a break right here. And when we come back, I do want to dig in a little deeper into cat care specifically because, like you said, cats don't get enough love. So don't go anywhere. I will be right back with Dr. Julie Liu. Welcome back to Covered in Pet Hair. I'm your host, Isabel Alvarez-Arata, and today I'm speaking with Dr. Julie Liu, who is a vet who travels for veterinary care as a relief vet. She is fear-free certified, and she actually helps pet sitters like me, or former pet sitters like me, learn about fear-free management for pets in the pet sitting world. That's how I met her. I met her at the Texas Pet Sitters Conference. She's also a contributor and a freelancer for various organizations. She writes, she cares for pets. She does it all. So I want to learn more about cat-specific care from Dr. Julie today. And actually, I'm going to invite you, Dr. Julie, to play a game with me called Cat versus Vet. And this is basically, I'm going to grab here my handy dandy clock, and I'm going to give you 1 minute. Maybe you'll need 2. You tell me. If you need 2, we'll give you 2. But I'm going to give you I'm going to give you a minute to tell me the top 10 reasons you think cats see the vet outside of obviously preventative care, vaccines, and things like that. Are you ready to play?
Mm-hmm.
All right, let's go. Go.
Well, one, unfortunately, I think is euthanasia. I think a lot of people, I'd hate to start off with that answer, but I've seen that quite a few times. 2, over grooming. I mean, these are not in order because now more answers are coming to my mind.
Exactly.
Behavior concern like house soiling, fighting with the, housemate, spraying, inappropriate scratching, vocalizing. So just maybe like prowling around, and meowing in the middle of the night. Medical issues.
That's 4.
Okay, 4. Well, I think some of these are both medical as well as behavioral.
Exactly.
But yes, but I would say weight loss could be one. Vomiting. Let's see, inappropriate urination. My cat maybe ate something.
All right. Well, we're over a minute. We're over.
I keep thinking of these behavioral issues. Yeah,
you're right on. So this was a list that I got from a 2018 report by Healthy Paws Pet Insurance, and this is just like how they code their visits, obviously. So a lot of these have what you said were the signs that lead to these diagnoses, right? Mm-hmm. So these, I don't know if they're actually they're in order of conditions, specifically diagnoses that cats see the vet for. And the first one is stomach issues. That's 29%. Like you said, they ate something. 2 is UTIs, 13%. Inappropriate elimination, like you said. 3 is skin conditions. Over grooming could probably be that, right? 12%. 4 is cancer. And I think weight loss might be something that is common with cancer. 5 is eye conditions. I learned that with Van Gogh when he came home from the shelter with ringworm on his eye, and everybody thought because his eye was so irritated that it was an eye issue, but it was really a skin issue above the eye.
Aw.
Another one, 8% is ear infections. 6% is pain. There was no specifics there, but pain.
Okay.
8 was growths. 4% was growth. So again, some kind of physical manifestation. 9 was foreign body obstruction. So you said that they ate something. And 10 is allergies, again, over grooming or allergies. So that is what vet cats see the vet for most often, at least in 2018. And again, it's been many years. So there's not been any more recent reports. So we can't really tell what's happening now. But we're talking about fear-free and cats, and we're talking about some issues that are pretty significant. Like pain, obviously, is going to put a cat on the defensive. Any kind of, poking and prodding for a skin growth or a skin condition is going to put cats on the offensive. And I want to talk about fear-free and how it impacts all of these vet visits. But for those who are listening who have never heard of fear-free, how would you describe it to a pet parent who says, I just go to whatever vet I find? And what would the benefits be of finding a fear-free vet?
It's funny because it's something I think about a lot. So I think about it from the perspective of me as a pet parent. Like, I don't like when my pet gets stressed. And that means that I also, for my cat Puff, who has a really high fear of the vet, I actually dread bringing him to the vet.
Exactly.
And unfortunately, as a senior cat, he just doesn't get as good care as my previous cat did, who had a low fear of the vet. So if you are able to really think about the emotional needs of your cat, they're also going to get better physical care because it's going to take away this barrier to veterinary care. And then, of course, pets that are more stressed, they're not going to be able to be handled as easily as at the vet as well. Again, speaking of Puff, he needs both oral medications to go to the vet and injectable sedation on top of that. Then, I think just thinking from the perspective of just, welfare and thinking about our emotional wellness, I think a lot of pet parents, like I'll go into the exam room and they're so stressed at seeing their pets stressed that they will actually be in tears and crying. And there's a lot of unconscious body language where you kind of walk in and they'll be kind of forming like a little wall around their pet like this, especially their cat. Because they are trying to protect them, but it's not even something they're, realizing they're doing.
Exactly.
So I think just thinking about, the emotional health component is equally as important as just thinking about these medical issues. And, for me as a pet parent, I really want to bring my pets to somebody who has compassion, and not just compassion for, they just aren't feeling well, but compassion of, my Puff is really, really scared right now. And when he is terrified, he's actually suffering. And I want them to really, think about my needs too, as a pet parent and as a caregiver.
Absolutely. And I think you said it before the break that a lot of pet parents, the fear of the vet will stand between them taking their pet to the vet.
Oh, yeah.
That seems to happen a lot more with cats than it does dogs. Is that your experience?
Yeah, for sure. Yeah. And I think there's multiple factors. One is that a lot of cats, aren't positively carrier trained. So the owners get really, stressed out thinking about putting their cats in the carrier and bringing them to the vet clinic. And I find that a lot of times, this isn't always every case, but many times feline or cat owners will bring their cat to the vet after their cat has been sick for a few days. They kind of wait and see if they maybe get better on their own. And then it's like 3 days into it, it's not uncommon to see a cat that hasn't eaten anything for 3 days. And then we're on day 3 and then we see them. Yeah. So I think it's just because we know that cats are typically scared at the vet, and that impacts the cat parent too, and creates that barrier that I mentioned.
Yeah, absolutely. And you said also veterinarians, sometimes there are veterinary clinics that are just cat clinics, which is something that's getting much more common. And there are also pet sitters that only care for cats now, which again is becoming more common, but it was maybe unheard of like 20 years ago. Why do you think some vets just prefer dogs, or some really thrive in a cat only practice?
Well, it seems like a lot of vet professionals are dog people. Like personally, like they
Mm,
have dogs. They think of maybe cats as difficult and unpredictable. A lot of them actually, I do think they're scared of handling cats because of
got it.
some previous injury. I know I've been injured by cats before.
Yeah.
And so a lot of that's like, oh, I don't really understand them. So I'm going to really not really
Yeah.
think about, handling them and try to and basically most clinics that see cats and dogs, a lot of times it's like set up to be a dog's world kind of thing.
Yes.
And whereas, cat people, like I mentioned that I'm a cat person, so I'm kind of a late bloomer cat person. But I just really, cats are amazing. And I think once you learn their body language and learn about ways that you can reduce stress at the vet clinic, it makes a profound difference in the level of fear, anxiety, and stress that they experience. And Puff, like he goes to a feline only clinic in Austin because I don't want him to hear barking dogs. I don't want him to
Yes.
smell dogs. I want him to be in as quiet of a clinic as possible. And I've done relief for a few feline clinics, and it is amazing, like the difference in decibel level in feline only, because it's just like, oh my God, there's no barking dogs. There's no even, whining, even like
Yes.
happy dogs that are thumping their tails,
Hmm.
against the door, making those sounds. It's just like that to me would be really, really scary if I were a cat.
Right. Right.
So
Absolutely.
yeah. Yeah. So I think that there's so many cat parents that just really need good care for their cats. And it's really up to us as vet professionals to think about, well, it's not just about these dogs. We really need to care for these cats too. And how can we do that even if we're going to be seeing both cats and dogs?
Well, my veterinarian tries her hardest. She only has two offices. She's a single veterinarian that has a
Uh-huh.
practice here in El Paso. She's wonderful. And she has a cat only room and a dog only room. So she
Oh,
tries, right?
yeah.
But like you said, we can still hear the dog next door whining or,
Yeah.
the whatever it is that is happening next door, which usually tends to be a dog, like the nails on the ground and all that.
Yep.
That does it even
Hmm.
puts me on edge because I'm always like, what's happening next door? And I
Yeah.
actually went to an emergency vet with Van Gogh when he started getting really aggravated about his eye. He was like hurting himself because he was so itchy. And I went to an emergency vet and I felt like I got the worst care I've ever gotten
Oh no.
in my life at a
Yeah.
vet office. And I
Yeah.
felt like, yeah, like he was a second class citizen. Sure, it was a really terrible night and they had a lot of emergencies and much more significant than his. So absolutely, take it in order of importance. But this the way of like they let me sit there for an hour and then they were like, yeah, we're not gonna be able to see him today. Can you just go somewhere else? And I was like,
Mm,
I've already been here
mm,
for an hour and they're
yeah.
only doing that to the lady with the cat, not everybody else who's sitting there who came
Yeah.
around at the same time. So it was almost like, yeah, they were kind of like, his
Yeah.
situation's not that bad. I'm like, it's ringworm and I have young children and another dog. So to me, it is bad, right? To me, it is
Hmm.
important that we get this like resolved or at least
Yeah.
diagnosed because I need to know what to do. And his eye is like, he's now scratching at his eye, which could cause
Oh,
other
yeah.
issues. But they
Yeah.
basically like sent me home saying it wasn't ringworm when it was. And I
Yeah.
felt like it was like, I told my husband I'd never here in El Paso or anywhere we've lived, I've never had such bad care. And I
Oh,
wondered if it was because it was a cat and they just didn't take it that seriously. I don't
yeah.
know. That's just like
Yeah.
some, it's an assumption I'm making, but it stood out for me for sure.
Hmm.
And luckily we got it resolved and he's all fine and dandy. So no worries there.
Yay.
Thank God. So I want to know for those families like me in El Paso, I don't believe, and I haven't checked recently, but I'm pretty sure we don't have a fear-free veterinarian or veterinary office here. What would you recommend we do either to encourage vet offices to become certified and learn these techniques, or should we consider online? What should we do?
Yeah, I think you can do a simple search. So fear-free is still a growing movement. So there really aren't that many fear-free certified practices. Like I'm in Austin, which is, the capital of Texas, and there's only
Yeah.
one, fear-free clinic in Austin.
Wow.
Yeah, and I was actually just looking earlier at Houston. I think there's only two right now that I was able to
Wow.
find. Yeah, but if you go to fearfreepets.com, you can look up, fear-free clinics. But yeah, and then similarly, you can look up cat-friendly practices. So through the AEFP, so it's cat catvets.com, and you can just do the drop down for find a cat friendly practice. But even if the whole clinic isn't certified, you can also just look for vets there who are certified, because to me, nobody forced them to get that continuing education. They chose to do that because it's something they feel strongly about. So as we know, it's the relationship you have with your vet as a pet parent is really, really, it's really special, and you want to find somebody who you trust. And that's a really great way for you to really think about, wow, this person actually has done some extra training and certification, and they know about the emotional health of cats and dogs. And so you can actually, on those other sites that I mentioned, you can actually also look for just a fear-free certified professional or a cat-friendly veterinarian.
Perfect. And just my last question, because I could talk to you about fear-free all day and I could pick your brain about cats all day.
Yeah.
But I do want to know, for those who aren't familiar, what kind of techniques could they expect to see with a fear-free professional or veterinarian or vet tech?
You mean in regards to cats or just in general?
In regards to cats specifically.
Well, some little things that I do is I really try to facilitate hiding in cats. So cats really like to hide when they're scared. And a lot of times they don't want to leave their carrier because it's their safe spot, and they're scared and they want to stay in there. So I will, if I'm seeing a cat, I will pre-spray a towel with Feliway, which is a feline facial pheromone analog, and it can have a calming effect. So I'll do that for my patients, in the morning when I get to work. I'll cover the carrier with a towel, and I'll try to let the owner know ahead of time, hey, we're just, gonna let the cat, hang out for a little second. Ideally, let the cat come out on her own, just this old school techniques, which I did when I first, became a vet, of if a cat doesn't want to come out, we'll we're just going to tilt the carrier and then shake the carrier until you fall out. So, because imagine to me, it's like, okay, if you're driving to your doctor's appointment and then this giant claw picks your car up and then shakes your car until you fall out. I mean, it'd be a terrifying experience, but that's, of course, what we're kind of doing routinely with our feline patients. I really try to have them come out on their own. I try to use lots of treats, a churu. I'm sure a lot of you are familiar with churu, but really, really palatable, meaty packets of meaty puree that lots of cats really like. And then just even, handling them in a really calming way, learning their body language. I'll keep my feline patients, if they're scared, I'll examine them on the bottom of the carrier. I'll pet them when they're covered with a towel. I let them, stay in the underneath the towel for handling. So yeah, just little things like that. Gabapentin, really super, super important, readily available, pretty inexpensive, can help reduce that pre-visit, anxiety, and can I have that on board before the trip so they're not hiding from you when they see the carrier. So little things like that just really make a huge difference in helping decrease that cat's stress levels.
And what can pet parents do at home to kind of start getting them ready for those vet visits? As you alluded to, positive training when it comes to their carrier.
Yes, positive carrier training. I really encourage cat parents to get the type of hard-sided plastic carrier where you can unbuckle and take the top off, because a lot of cat carriers, if it's a soft carrier, it might be a really cute carrier, but it can be really difficult for the vets and vet techs to actually access your cat, because a lot of those soft carriers, you have to reach in and pull the cat out. So instead, I want to just be able to unbuckle the carrier and take the top off and cover the cat with a towel. So doing something simple as that, making sure that you take the carrier out, I would say a few weeks ahead of time before your visit, if you're not going to do that positive carrier training. So we don't want to take it out and have it live in the garage where all the screws get rusted and everything. And then even just, you can purchase Feliway wipes yourself. So you can actually wipe down the inside of your carrier, have some nice cozy bedding in there. I do that for my cat 30 minutes before he goes to the vet. And then always make sure that you secure your carrier in the car too. So we don't want to have a loose cat or anything like that. And so the safest place for a cat that has the least amount of motion is on the floor behind the passenger seat. So that's where I put my cat's carrier.
Perfect. Well, thank you so much. I want to propose a toast to you for taking chat with me.
Thank you so much. It was really fun.
You again. Me too. I had so much fun seeing you again and chatting with you. I also want to propose a toast to our executive producer, Mark Winter. Thank you, Mark. And to our audience for joining us for these awesome conversations. Cat lovers, I've got you. I've got awesome people like Dr. Julie to talk only about cats because it's hard to do. It's hard to find awesome people like you that are willing to come out of their, cat house and talk on these radios. Dog people tend to be a lot more, I guess, camera friendly, comfortable in front of the camera. A lot of the best.
Okay.
Yeah. A lot of the best cat people are like, nah, I'm good. I don't want to go. I don't want to be on the camera.
They're cuddling with their cat on the couch. Yeah.
Yeah, they're too busy solving the cat problems of the world. So I want to propose a toast to everybody for joining us for these awesome conversations. Thank you again, Dr. Julie. And here's to a life covered in pet hair, because there's no better way to live. Cheers.
Cheers. Thank you so much.
Oh, it's my absolute pleasure, truly. I've totally enjoyed it. To learn more about Covered in Pet Hair, please visit coveredinpethair.com or petliferadio.com. I will put all of Dr. Julie's links in the comments and in the show notes, so make sure you follow up with all the wonderful things she's doing, and I will see you next time. Thanks again for watching. Goodbye.